Good morning. How are you today? Today I want to talk about something that I've been studying and find interesting, and that is craniosacral therapy, or CST, which is a gentle, hands-on treatment involving light, sustained pressure on the head, neck, and sacrum to release facial tension and improve cerebrospinal fluid circulation. It has been used for a while, and it has showed a lot of potential to help, for example, with pains, and it is, chronic pains, fibromyalgia, stress, anxiety, post-concussion symptoms, and PTSD, post-traumatic stress disorder, for example. Uh, but you should know that it doesn't really replace conventional medicine, but you can use it with that, and it can help a lot if there's need for it. And the touch can be really healing, but it's important to establish a trust between the patient and the practitioner. Some people have some trauma from their past that affects the way, or like how they are ready to receive treatment. But like I read somewhere, then the first step is coming there, and then there's a part of them that's ready for treatment if they come to get help. And you can, as a practitioner, in your mind, let them know that they're safe, and just they can let go and relax and when they're ready. But it takes time sometimes to establish trust, which is normal, of course, when you don't know the person and you've been through something. All kinds of things, people have been through all kinds of things in their lives. But practitioners focus on the membranes and fluids surrounding the brain and spinal cord, and often work on the skull, sacrum, and the spine. The difference between that and Reiki is that it focuses more on blockages and releasing blockages than Reiki. And Reiki is more general, just a good energy. Patients remain fully clothed, and practitioner applies light pressure to evaluate the craniosacral rhythm. And there's something really interesting, which is that part of the body can be in a separate rhythm from the other parts of the body if there's been some trauma to the body. There's also somato emotional release, where people have gone through past experiences and become children, and they are aware of what's going on, but they just let out completely freely their emotions. And it can be so helpful, like just to find out what your purpose is, and like where you're gonna go in your life, and forgiving and creating better relationships with others. So that's something that a lot of people could benefit from, I believe. And there's evidence, that some claims regarding children under 2 are debated, and the anatomical basis is disputed. But it can, with someone who has a lot of experience and knowledge about craniosacral therapy, you can use it from birth, like right after birth. But just be careful, of course. A lot of experience, like I said. yeah, it's interesting that it can work well with acupuncture, and it even helps a girl from waking up from coma. 24-year-old girl that had been in coma for 3.5 years. And just sometimes people make something, create something in the mind that is to stop them from doing something if they don't really want to do something. But by going through this, they can see that they, this is something that they don't want to do, and then change the way and to the path that they actually want to go in their lives. So it's just really beneficial for many people, I believe. Um, yeah, the rhythm can be from, for example, 8 circles a minute, uh, up to 30 circles per minute, or around 30 circles per minute, or even a bit more. So there's a lot of difference in the craniosacral in the body. And yeah, so it is just non-invasive and can bring a lot of peace and closure even. And yeah, thank you for listening, and I hope you found it interesting.